Welcome back to Jersey Matters. Over half of the deaths in New Jersey from COVID-19 were at the state's nursing homes. A lot has been made about a state directive that nursing homes accept COVID-19 patients. What exactly happened? We asked Evelyn Liebman, the New Jersey Director for Advocacy at the AARP. Evelyn, thanks so much for talking to us again. A lot has happened since the last time we talked with you. I wanted to talk with you specifically about the accusations that certain states, including New Jersey, forced COVID-19 patients, mandated that nursing homes accept COVID-19 patients once they were released from hospitals. It sounds horrible. Is it that cut and dry? Is that what happened?
Well, Larry, thanks again for having me back. There are a lot of questions around how New Jersey, other states, really the entire country has responded to this pandemic, particularly in nursing homes. It is really a tragedy that should never have happened. And in New Jersey, nursing home resident deaths represent about half of all deaths here in New Jersey. And we continue to have hundreds of facilities with infections that continue to rise, and the numbers of those dying, sadly, continues to rise. In March, the state of New Jersey did advise our nursing home operators to accept admissions from acute care facilities, hospitals.
And let me stop you for a second, because you use the word advised. The word that's being used is mandated, or the word that's being used is they gave a directive. Which is it?
I believe it was a directive, but I know that this is going to be the subject of oversight hearings in our New Jersey legislature, and certainly the governor has talked about needing to do a postmortem, and we absolutely do. But I think it's a little more complicated than that, in the sense that, nursing home residents have certain rights, and nursing home operators have certain obligations, and the state of New Jersey and the federal government are obliged to ensure that those obligations are met. And first and foremost, that is that a nursing home resident has the right to be cared for safely, and in an environment that respects their dignity as someone would expect to be treated in their own home, which is a nursing home. So nursing home operators have an obligation to be able to care for someone safely. And if there was a directive that required admissions, it was still the obligation of that nursing home operator to provide safe care. And if they
From what you know with the AARP, did that happen? Were they all cared for properly? That you said it is their responsibility to make certain, no matter what the directive is, that people are cared for properly, yeah, and kept safe. Did that happen?
Well, we have a lot of questions about that, and that's why we need to have more oversight hearings. We do know that there did not appear to be adequate staffing levels, whether it be certified nursing assistants, nurses, infection specialists. We know that fully a third of New Jersey's nursing homes had been cited for violations in infection prevention and control procedures prior to the pandemic. We have heard many reports that there was not adequate personal protective equipment, masks, gowns, gloves, and that we were not testing in a manner that we needed to be. So all of those things combined cause us to question whether or not there has been, and is there even now, the kind of quality and safe care that everyone needs.
When I asked the Senate President Steve Sweeney last week, will there be hearings? He said, absolutely. When I asked about this directive, he said it was a mistake. Came right out and said that was a mistake. You need more information at this point?
I think that we need to hear from the Department of Health, and we need to hear from the operators as to how they responded to that directive. We also need to hear from them as to how they responded to a directive that came out just several weeks later, that any nursing home that was not able to cohort residents, meaning separate residents had infections from those who don't, were not allowed to accept admissions, and whether or not that also occurred. So I think we need to look at what happened, not just in response to that particular directive, but also what has happened in response to the succeeding directive. And most importantly, what are we doing to solve the problems that have been so tragically exposed and ensure that they never happen again?
What would you like to see happen for the next time? What did we learn that you want to see enacted?
Yeah, well, one of the most important lessons that we learned is that this pandemic has exposed underlying and systemic problems within our nursing homes that existed pre-COVID-19. And in particular, that involves the level of staff. You can't have quality long-term care, particularly in nursing homes, without the minimum level of staff and well-trained individuals needed to provide that care. So we have been working for many years to establish just minimum staffing levels for nursing homes. For certified nursing assistants, for example, those are the folks that really provide the day-to-day hands-on care for so many residents. But the report has also suggested that we look at minimum staffing levels for registered nurses, for licensed practical nurses, and to ensure that we have infection prevention specialists on hand in the facilities every day, a gap that the pandemic has exposed and that the report spoke to.
Wonderful. Again, thank you for your time. Evelyn Liebman, AARP's Advocacy Director for New Jersey. When Jersey Matters comes right back, gym owners are not very happy with Governor Murphy still not giving them the green light to reopen. We'll talk to them next.